Hello, I'm Cristóbal Cepeda and I'm the President of the Scientific Commission for Animal Diseases. I would like to present the annual report of the Commission. The presentation highlights the main issues of interest for the World Assembly. However, if you want to gain more in-depth understanding on the scope of the Commission activities, I invite you to consult the Commission's meeting reports available on the OIE website. First of all, I would like to thank the Director General, Monique Eloy, and the Deputy Director General, Matthew Stone, and my colleagues on the Commission for their invaluable support during this year. And of course, a special word of thanks for the OIE Joint Secretariat. They are truly the backbone supporting the work of the Commission. The quality of their work and their professionalism are outstanding. In addition to the report of the OIE activities related to COVID-19, I would like to highlight the work done with the participation of the Scientific Commission. We have established two ad hoc groups. The ad hoc group on COVID-19 and the human-animal interface, which initially was an informal advisory group, now an ad hoc group. And we also have the OIE ad hoc group on COVID-19 and safe trade in animals and animal products. The conclusions of the work of these two groups are captured on the OIE COVID-19 question and answer page on the OIE website. In addition, on the page, you will find links to the reports of the meetings. It is important to note that the OIE does not recommend any COVID-19 related sanitary measures be applied to the international trade of animal species and their products, determined to be non-susceptible to infection with SARS-CoV-2. For SARS-CoV-2 susceptible species, any decision to require measures should be based on a risk assessment. Precautions for packaging materials are deemed unnecessary over and above the observation of basic hygiene, such as ensuring that packaging is clean and free of visible contamination. For the period between May 2019 and May 2020, the Scientific Commission held two commission meetings in September 2019 and February 2020. We oversaw the work of 9 ad hoc groups and one working group, the working group on wildlife. In addition, we participated in the two COVID-19 ad hoc groups. Also, during our meetings in September and February, we had coordination meetings with the Code Commission. With regards to status, we reviewed 22 applications for disease status recognition and endorsement of official control programs. And in addition, we held 5 electronic meetings between members of the Scientific Commission. We held ad hoc groups on piroplasmosis and contagious equine metritis, on BSE, rabies, classical swine fever, foot and mouth disease, CBPP, PPR, African swine fever, and the two COVID-19 working groups, the animal-human interface and the one focusing on trade. We updated several chapters of the code. The specific changes proposed and rationale supporting them can be found in the Commission reports. We reviewed proposed changes to the glossary, to diseases and infections listed by the OIE, animal health surveillance, procedure for self-declaration and for official recognition by the OIE, zoning and compartmentalization, and I'll come back to this later on in the presentation. Foot and mouth disease virus, where we reviewed a proposal to list safe commodities by a group of member countries. We also reviewed changes to Mycobacterium bovis and Mycobacterium capreae infections. And also we reviewed the chapter on rabies. The available scientific evidence and the expert opinion for the exportation of dogs from infected countries supports a reduction of time between vaccination and testing. A proposed change will be presented in a subsequent review of the rabies chapter. The Commission approved the questionnaire for application for the endorsement of official control programs for dog-mediated rabies. The questionnaire for dog-mediated rabies provides detailed operational guidance to implement the requirements of Article 8.14.11 of the Terrestrial Code. The questionnaire is available on the OIE website to facilitate its revision. The questionnaire will support members in the development of their dossiers for evaluation. The first endorsement by the Assembly of programs submitted by members is expected in 2021. The deadlines for members to submit their dossiers for assessment through the OIE procedure will be communicated by the first week of June in 2020. Having an OIE endorsed control program is important because it will pave the way for countries to self-declare freedom from rabies. In addition, we also reviewed the chapter on Rift Valley fever, animal trypanosomosis of animal origin, contagious equine metritis, equine influenza, equine pyroplasmosis, PPR, and classical swine fever. The OIE continues to support several global strategies and initiatives regarding foot-and-mouth disease, PPR, rabies, and African swine fever. Several activities were carried out in support of a global foot-and-mouth disease control strategy. The second foot-and-mouth disease roadmap meeting was held in Senegal. During the meeting, national and regional FMD situation in the 16 countries represented was reviewed. The participants discussed the progress on implementation of their national FMD control plans and identified challenges and needs for the implementation of the strategy. All the attending members in West Africa used the PCP self-assessment tool satisfactorily for the first time to undertake an assessment of their countries regarding progress along the PCP FMD pathway. In addition, an epidemiology and laboratory network meeting for the Middle East was held in November 2019 in Egypt. Due to COVID-19, the South Asian Association for Regional Cooperation region meeting scheduled for April 2020 in Nepal was postponed. Also, the roadmap meetings for East Africa, Southern Africa, and Central Africa in 2020 will have to be rescheduled. The Commission received during its February meeting an update from the World Reference Laboratory on FMD. As you know, there are 7 pools of FMD virus activity. Dr. King expressed his concern with the recent long-distance trans-pool movement, most notably from Pool 2, but also from other pools in Africa and Asia. Regarding the PPR Global Control and Eradication Strategy, in 2019, the second round of PPR regional roadmap meetings was finalized for all regions except for the roadmap for the region of East Africa and Southeast Asia, postponed for 2021. In August 2019, the third round of PPR regional roadmap meetings was launched with the Economic Cooperation Organization countries in Tashkent, Uzbekistan. 6 PVS follow-up missions with a PPR-specific content were completed in Turkey, Afghanistan, Nigeria, Chad, Burundi, Liberia, Iran, and Mongolia. Lessons learned from these meetings will feed into the PPR monitoring and assessment tool PMAT revision. At the second meeting of the PPR Global Research and Expertise Network hosted by ILRI in Nairobi in Kenya, jointly with the AU IBAR, a first draft of the FAO OIE guidelines for the control and prevention of PPR in wildlife population was presented and endorsed by the participants. The OIE and FAO are now in the process of finalizing those guidelines, which aim at providing a conceptual framework of wildlife-related components to be considered when planning a PPR eradication activity. A workshop on the epidemiological assessment and vaccination management in the Lake Chad epizone was held in Cameroon. This was a pilot meeting introducing the epizone approach for the coordination of PPR control and eradication across regions and between countries sharing common borders and epidemiological characteristics. This exercise received positive feedback, and now the second epizone workshop is being organized by the Northern Asia epizone, China, Kazakhstan, Kyrgyzstan, Mongolia, Russia, and Tajikistan for the last quarter of 2020. The United Against Rabies Collaboration is a network that includes the OIE, FAO, WHO, and the Global Alliance for Rabies Control. The annual report was presented on World Rabies Day on 28 September 2019, highlighting the achievements on increased access to dog rabies vaccine, improved medical care for cases of human rabies exposure, and enhanced rabies awareness in several countries and regions worldwide. With respect to African swine fever, the OIE and FAO are developing a strategic plan to reach the specific objectives needed to support global control of ASF using the GF-TADS framework to harmonize and coordinate national and regional efforts. A member of the Scientific Commission was selected to participate in drafting of the strategy. We'll now move on to status recognition and the endorsement of control programs. These are the Commission recommendations. 2 expert missions were conducted to Colombia and Romania. Missions are important because they provide value to member countries, helping them to better understand the application of OIE standards. A total of 360 annual reconfirmations of status were assessed, and the Scientific Commission comprehensively reviewed 43 of them during the February meeting. The Scientific Commission reviewed and prioritized the planned missions to member countries for official recognition or for maintenance of disease status and endorsed control programs. We'll now move on to member status evaluations. For BSE, we are proposing 2 additions. We are a country of negligible risk, being Bolivia, and Jersey as a zone of negligible risk. For classical swine fever, we are proposing 3 additional countries as countries free from classical swine fever: Croatia, Kazakhstan, and Malta. For foot and mouth disease, we are proposing the addition of an FMD-free zone without vaccination in Chinese Taipei and free zones with vaccination in Brazil and Colombia. In addition, we are proposing the endorsement of the official control program for foot and mouth disease of Kyrgyzstan. For CBPP, we are proposing the addition of Bolivia and Russia to the list of countries free from CBPP. For PPR, we are proposing PPR country freedom from Lesotho and Russia. Here are the tentative dates for the ad hoc group meetings for member status evaluations and deadlines for submission to the OIE for 2020 and 2021. It is important that the deadlines for submission are respected to provide enough time for analysis by the status department and the respective ad hoc groups. So the deadline for submission for African horse sickness is July 24, for BSE, July 31st, for CBPP, August 7, August 14 for foot and mouth disease, August 28 for PPR, September 18 for dog-mediated rabies, and finally October 8 for classical swine fever. During our February and September meetings, we held coordination meetings with the Code Commission. 2 meetings were held to discuss topics of common interest, including the procedure for evaluation of diseases against the listing criteria, an approach on how to update the foot and mouth disease chapter, which now has been on hold for quite some time. We are proposing the need and discussing the need to have case definition for all listed diseases, and we discussed extensively the concept of the protection zone. In this regard, we are proposing significant changes to the concept of a protection zone. A member will be able to establish a protection zone in the face of an increased risk. An outbreak in this protection zone will not affect the status of the rest of the country. For diseases with official OIE status, the Scientific Commission will need to be notified. An expansion of the current mandate will be required to approve the protection zone using a fast-track process. With regards to disease control specific issues, the Scientific Commission has been following closely the newly detected camel prion disease. CAMENET, the Camel Middle East Network, has now launched a wide-ranging proposal for training, coordinated surveillance, and research. The Enhancing Research for Africa Network has developed a project aiming to increase coordinated surveillance for camel prion disease in North African countries. In addition, the OIE published a special article on the disease on the OIE Bulletin. During our February meeting, we discussed the future work program of the Commission. We will review and finalize the draft of amended chapters on BSE. We'll review provisions of on the chapter of foot-and-mouth disease virus. We'll harmonize the requirements in the terrestrial code for official disease freedom. We will continue our work in zoning and compartmentalization, focusing on the protection zone. We will continue to work with animal trypanosomosis of animal origin. We'll reassess Mycobacterium tuberculosis complex against the listed criteria. And we will follow up the development of the methodology to develop and improve case definitions for all listed diseases and the guidelines on compartmentalization for African swine fever. I would have liked to present this in person in Paris, as we usually do during the general session, but due to the COVID-19 pandemic, unfortunately, we are not able to meet in person. But I'm really looking forward for 2021 to talk to you and receive also your questions. Thank you very much for your attention.